Is buccal fat removal related to its role in infant suckling? Imagine a baby feeding at the breast or bottle. The cheeks stay firm and rounded, helping the baby create the right suction. That's thanks to the buccal fat pad, a special fat deposit in the cheek area. In infants, these fat pads are quite large and act like cushions or sucking pads. They help stabilize the cheeks and prevent the mouth from collapsing inward during suckling. This support is essential for creating the negative pressure needed to draw milk efficiently. The buccal fat also cushions facial muscles and blood vessels involved in feeding. Interestingly, in newborns, the buccal fat pad contains brown adipose tissue, which may help keep the muscles warm and ready for the energy needed during suckling. As children grow, the buccal fat pads gradually shrink, and the face develops more defined contours. In adults, the buccal fat is much smaller and no longer plays a role in feeding. When adults choose to undergo buccal fat removal, it is purely for aesthetic reasons. The procedure involves removing some of the fat pads to create a slimmer, more contoured face. It is important to understand that this surgical removal is unrelated to the original function of the buccal fat in infants. So, while the same buccal fat pad is involved in both infancy and adulthood, its purpose changes over time. In babies, it helps with feeding by supporting the cheeks and aiding in creating a proper seal. In adults, removing this fat is about enhancing facial shape, not affecting feeding ability. The anatomy remains the same, but the function shifts from a vital feeding support to a cosmetic feature. In summary, buccal fat removal in adults has no connection to its role in infant suckling. The fat pads serve a critical function in early life but are not necessary for adult facial structure beyond aesthetics. Always consult a qualified healthcare professional for personalized advice about facial procedures or concerns about facial anatomy. Understanding this distinction helps clarify that the two roles are separated by age and purpose, with the removal being a cosmetic choice rather than a functional one.